This is KEZI 9 News, breaking news.
I'm Brian Anderson. Lane County Public Health is holding a press conference right now on the newest case in Western Oregon. Let's listen in.
To do with COVID, had to do with other medical conditions, and then was tested while in the hospital. I wanted to bring to your attention some new information that we have about one of our cases that we announced yesterday. The gentleman in his 40s from the Eugene Springfield area, and that piece of information is that through our contact investigations, we were able to trace back how he initially contracted COVID and where that point of contact happened. So that is establishing that epidemiological link, which essentially just means that we know how he got sick and are able to trace that back and then start working backwards from there and understand to a greater capacity how the disease is moving through our community. Another piece that I would like to also highlight is this came from a conversation I had earlier today with Dr. Ludke, looking at various models of disease spread, starting with Wuhan, China, Italy, and a few other different areas. There seems to be a commonality between when they saw their first symptom onset, their first cases start to pop up, and when they saw the greatest spike or that initial exponential curve. And roughly it's around 6 weeks out from that initial symptom onset. We are now 38 days out from our first case initial symptom onset, and so we are watching attentively over the next couple weeks for the situation, because this really will be a pivotal time that will help define the overall trajectory of our situation here in Lane County. So for the public, really what that means is just the expectation that if we're going to see the high number of cases, we can expect that to be happening in the next few weeks, and to brace for that. Hopefully, of course, the methods that have been put in place, both through social distancing at the state level and the requirements and guidelines handed down there, and then also the public participation that we've seen happen in our community, will pay dividends, and we will actually not see that exponential spike, that we will see a gradual trickling of cases, a plateau, and then a fall off. And so that's ultimately what we are hoping for. I would also like to point out the fact that, typically as an informational tool, we really draw attention to where the problems are in the community in hopes that we can see improvement on those problems. When it comes to social distancing, we have highlighted, areas where we could do better, and certainly we can always do better. However, I think it's important to acknowledge the fact that from our surveillance and what we have seen so far, the majority of the community really is following social distancing, and that impact is being felt on our overall case trajectory. So thank you for everyone who is doing their part by staying home and keeping up that distance. You are actively slowing down the spread of COVID-19 and helping us flattening the curve. At this time, I will go ahead and take any questions from members of the media.
So we'll start with 2 questions from Michael Severin at KEZI. The first is whether or not Lane County Public Health has explored the idea of having a centralized hospital for COVID patients, and if that were to happen, would it allow other elective services to resume?
So our first question is from Michael Severin at KZI, and Michael would like to know whether or not Lane County has explored the option of a centralized hospital for COVID patients, and what the thinking behind that would be, and whether or not it would be an advantage in our ability to treat patients during the surge, or if there was a surge. Yes, we have absolutely considered that option. That is a tactic that is largely employed in areas where they have public hospitals. Of course, you know that all of our hospitals here in Lane County are private, and so the way in which we see patients is a little bit different in terms of not having that centralized resource. Now, if we did get to a situation where we exacerbated or exhausted rather our capacity to treat COVID-19 patients, then a triage facility could be set up where patients could potentially be sort of centralized in that capacity. But right now, based on the data we have and based on the boots on the ground response that we're seeing, that would not be a needed strategy. We do have we convene all of our hospital partners and other responders weekly, and we talk about the different objectives and different strategies to employ. That meeting is happening tomorrow. Again, it happens weekly. And on on tomorrow's agenda is that very topic about how we disperse and how we centralize. So looking at both models and further evaluating which one is going to be more effective. But yes, we have considered it, and it's just not the right move right now.
The follow-up is, are the latest models that Lane County Public Health is using showing a decrease in the number of projected cases compared to previous models?
Another question from Michael is, are the current models that Lane County is using projecting a decrease in overall number of cases? And basically I think what Michael is trying to get at here is that number changing? Are we starting to project out that there will be fewer cases? And I think, it's too soon to tell. I think that part of the problem with a disease cycle and outbreak is that we can certainly have interventions, we can have a lot of tracking and data collection, but ultimately the virus has a mind of its own and will move in whichever ways it sees fit, and then we try to predict that. Our best guess, though, is that what we see on our current models, and these are our current models that project out that peak around early May 6th, again, that's going to be a little bit different for the whole state of Oregon, including the metro area. That's going to be a sooner peak, so you're looking at the end of April for that peak, but this is for Oregon outside of that Portland metro area. And within each different scenario, there's 3 scenarios here. One is due very little, one is due a moderate amount, and the final one is aggressive measures, which we haven't completely fallen into that category. But where we're seeing some movement is in that moderate category. So the initial projections really looked at case numbers and peak times based on sort of a median frame within that range. And so what could very well happen is movement within that range. The initial numbers we're looking at a cumulative outside of Portland Metro within our current actions of between 5,000 and 10,000 cases, and a daily peak of potentially upwards of 2,500, from 1,800 to 2,500. However, it's good to acknowledge the fact that range on those moderate levels could go down as far as 400, and then all the way up to potentially over 1,700 per day. Again, that's all of Oregon outside of the Portland metro area. So to answer your excuse me, to answer your question, Michael, the answer would be that there is a range, and I think that given the current modeling and the data that we're seeing, that we are expecting the number to be lower than the initial figures, and that really, again, goes back to the community involvement and participation that we've seen on measures like social distancing and staying at home. And really, if we continue to double down on those efforts, and we see this through the peak, through the plateau, and down the other side, then that will help us get to a place where we have fewer overall cases, we have fewer daily cases, we have less loss of life, and we have a greater capacity to serve people. And so those are all the objectives that we're working towards and hoping for.
Question from Rachel at KLCC. She notes that LA residents are being advised not to leave their homes for 10 days, including to go to the grocery store, apparently. Is that something being considered for here?
So the question from Rachel at KLCC is that Los Angeles residents are being told to not leave their home for 10 days. And she's wondering whether or not that recommendation is being considered here locally. Rachel, I have not heard any talk of that sort of recommendation coming to Lane County residents, and certainly not from Lane County Public Health at this time. So I think what's really important for folks to understand is that the way our public health system works is that it's graduated from the federal level to the state level to the local health departments. And the reason being is that each individual community, each county has specific needs and has a different way of operating and meeting those needs. And so what's right for Los Angeles during this time might not be what's right for Lane County. And that what we really need to do is pick the objectives and the actions that are going to strike that balance of maintaining some semblance of a normal life with also social distancing and staying at home and trying to curb the spread of disease. And so I believe that we are doing an adequate job of tracking and making sure that our recommendations are commensurate to where we're at and what we need. But certainly you're going to see different measures being employed across the country, some more extreme than others. And we know that the public health officials in those communities are faced with the same challenge and the same decision-making capacity.
Jordan Brown with the Register Guard. You mentioned there are some areas or instances that LCPH has seen where we can improve the social distancing. Can you give some examples?
Jordan Brown from the Register Guard asks, we have mentioned that there are areas where social distancing can be improved. Can you give us examples of those areas? And so what I would probably point to is both an area of improvement and then also some improvement that we've seen just in the last 48 hours on that piece. So we've mentioned grocery stores a number of times and the challenges inherent within that situation, knowing that we need to keep those grocery stores open for folks to be able to get basic necessities and food, but also acknowledging the fact that we have a lot of people that are staying home all day long and depleting their resources rather quickly and need to make those trips to the grocery store. And so it's resulted in situations inside the grocery store where social distancing isn't happening. And it's not limited to one grocery store. This is a challenge felt by numerous grocery stores. And so what we've seen happen this week, which we believe is an effective model, is grocery stores limiting the number of people who can come in at any one time to facilitate that social distancing and just make it easier overall throughout the store for that to happen. And just by that one move, that's helping the overall social distancing. I think we've seen trouble just with the interactions that are so routine for us. People really applying that new lens about keeping the distance, but also being able to make those necessary transactions. And government can give guidance on that, but ultimately there's a learning curve, and people have to get used to that. And so I think earlier on we saw some confusion and just getting used to doing life as normal or life as usual while keeping social distancing, those necessary transactions, et cetera. But now we're seeing more and more people adapting and figuring out how to do simple things like take their dog on a walk while keeping social distancing. Buy a coffee if they need one while keeping social distancing happening. And we're seeing that happen both from the business owners and from the community. But certainly I think in those everyday interactions we can expect there to be missteps and there to be improvement.
Back to Rachel at KLCC. She's wondering if any concerns over warmer weather and the Passover and Easter holidays will make social distancing harder this week.
So another question from Rachel at KLCC, and she's wondering about the religious holidays that are coming up this weekend, and also the warmer weather that's also happening this week and carrying over into the weekend, and whether or not that could potentially make social distancing a challenge. And whether or not public health is concerned about that. And yes, absolutely, we are concerned about that, knowing that these are very important holidays for many people, and the need to observe those holidays is certainly not gone away. We do expect, and we've already seen evidence of this, that many of our faith-based organizations are seeking alternative routes to be able to observe those holidays while maintaining social distancing. So having their church services online, and then also areas where there would be necessary socialization that's happening online. We are aware of a few places in the county that need some additional communication on how to observe that, and so we're making those connections through our liaison branch within our emergency operations and continuing those conversations. I think it's reasonable that people need to be reminded. Again, we've tried to stress that this is not normal. This is not life as normal, and so part of that means reminding and helping people understand the overall impact that they have through the decisions that they make on a daily basis. The other piece is the warmer weather. So I think in terms of a disease response, we've been very fortunate to have some rain. The natural elements that have helped us want to stay indoors and not get wet. The weather is changing. I can look outside right now and see blue sky, and so obviously I think we have to, as a community, remember the impact that we can have on that curve. and balance the need to get some fresh air and to step outside with the need to stay home and keep your distance from folks. So we're not saying that people can't go outdoors right now. What we're saying is only go outdoors if you have a specific need that is essential. So, you know, walking your dog needs to go outside and go to the bathroom. That is an essential need. Do that, but do it wisely. Maybe stay away from just the sunbathing and unnecessary time outside where you're not necessarily giving other people the opportunity to be able to get out. So I think all of this really comes down to personal discretion and the assumption that we as public health have that our community understands the impact they can have. They understand what's at stake here, and they're going to behave responsibly. And I think that that is the best that we can hope for, and then we can watch that unfold over these next few days. If we don't see it happening, we'll be back up here reminding folks, we'll be making the phone calls we need to make, and we'll be touching base with key groups within our community to try to encourage social distancing and staying at home.
James with CORE. With the peak expected in the next few weeks, what additional measures are law enforcement taking, if any?
So the question comes from James, and he was asking about law enforcement and what, you know, with a potential peak coming in the next few weeks, what additional steps are law enforcement taking. So I actually just talked with a member of our sheriff's office, and they have PPE available if they get called into a scenario where they have interaction with an individual who might be having symptoms. They have training on how to interact with individuals on a routine basis, but maintain that social distancing. And I know that's also happening for our other law enforcement agencies. And then currently, we are also communicating with our law enforcement partners almost on a daily basis, really trying to get them the best information so that they can have a good baseline from which to start from. So what I see happening is that law enforcement is moving like the rest of our community and our partners in tandem, that we're all moving through this together, and we're sharing resources and we're sharing information. And so I think that's sort of a best case scenario at this point. And I think that we, at least in terms of communication, are heading into the spike and the peak with a good situation under our belts.
All right, that's it.
And that's all we have. We'll see you tomorrow.